Hello, I'm Jamar Brown with Successful Physicians Monthly Magazine, and I'm here today at the Innovation Economy Expo with Richard Antoine, who is the CEO of Magnus. Richard, how are you doing today?
Great, Jamar. How are you doing?
Excellent, excellent. Now, we met earlier, and I was really interested in some of the things that your company does from a communication standpoint in the healthcare space. Can you tell me about some of those things we talked about?
Essentially, Magnus is a healthcare company that specializes in languages. Okay. We help healthcare practices, hospitals, health plans communicate in different languages with the members and patients they serve.
Okay. Now, how did you start the company? I know that's a big need in the healthcare space with the flood of patients and the changes in healthcare, but how did you start the company, and what was the focus behind starting the company?
Well, about 20 years ago, my wife was working at a hospital over in the San Gabriel Valley, which had a very, very large Chinese population they served. Mm-hmm. She had a hard time finding qualified Chinese linguists. I have an MBA in international business, and I'd actually done some translation while I was living and working in France, and decided this would be a good market niche for us to explore.
Okay. And so your wife was the main one that sort of opened up the idea behind doing the translation. And then at what point did you actually start your company?
It took about 3 or 4 months for me to do some research. Mm-hmm. And as we all know, behind every successful man is a great woman.
That's true.
And here we are 20 years later.
No, so Richard, tell me about some of the programs that Magnus offers to physicians and hospitals.
One of the key programs we offer is we actually train medical healthcare interpreters. Okay. Now, facilities often will need someone to assist with interpreting for a patient, because the patients don't understand, they don't speak English.
Right.
And the staff will speak maybe Tagalog or another language, but not the language of the patient. Mm-hmm. The interpreter can help make that communication clear, so the patient is able to understand their care, agree to their care, and then follow the course of treatment that's been prescribed. Okay. With our program, we actually train bilingual individuals to become certified as medical healthcare interpreters. But a key part of that process is that just like a doctor has to do his residency before he can become a full independently licensed doctor, right, interpreters also need to do what's called a preceptorship, where they actually spend time interpreting for patients. Now, when a hospital engages with our program, they can then have interpreters working at the facility who are professionally trained. They have been assessed for their bilingual skills, they've been trained, and now they are providing interpreting services free of charge for the hospital. With interpreters charging upwards of $100 per hour, it is very easy for a facility to earn or save over $50,000 a year by having free medical interpreting services.
Richard, you mentioned that one of your, clients was Rancho Los Amigos, and you mentioned how they benefited from this preceptorship type of training for your interpreters. Can you talk about that a little bit?
Yes, actually, Rancho Los Amigos was one of the first facilities to sign on to our program. Okay. They are a host site for training, so we actually conduct the interpreter training sessions at their facility in one of their in-service meeting rooms. Okay. And then the graduates have now been volunteering at Rancho Los Amigos. Okay. So far this year, they have benefited by over 500 hours of free hours of interpreting services. And again, if you look at $100 per hour times 500, the economic case for hosting these people is very, very clear. Tens of thousands of dollars in free services.
That's a great program. I mean, I am from LA and have been in the LA market. I know how diverse LA is. Yes. And so with your services, I bet that's a huge market for you in LA, but not just in LA, but around the world. But LA is such a melting pot that I would imagine it's a strong bed for you from a business perspective.
That's exactly right. And there are so many languages which we train, and Rancho has benefited from those, but there are other facilities out there and more patients that could benefit by having those interpreting services. And the benefit goes in many different ways. Certainly there's the dollar value of having those interpreters for free, but then you look at patient satisfaction and the HCAPP surveys. A doctor and the hospital are both rated by the satisfaction of the patient. Some of the key questions are, how well did you understand what the doctor explained to you? How well did you understand what the nurse said? Right. By having the interpreter present, now the patient understands and the HCAPP scores go up. Okay. And there's clearly an economic benefit to that as well.
Well, I think that's a very significant point, because I know one of the changes in healthcare potentially is more of a focus on the care part of patients versus the health. And by care, I mean how patients are treated, how they interact with the staff, how their doctor communicates with them. And when there's a language barrier, I would imagine that that definitely gets in the way of the care part of healthcare.
It certainly does. One of the key factors is how well does the patient understand what they've been told to do. Now, if there are discharge instructions and the patient does not understand them, they might nod their head, they might say yes, but do they really understand? And with the help of an interpreter, it is far more likely they will understand. With the interpreter and using things like a teach-back technique, where the physician explains, then asks the patient to teach back, to explain back. The interpreter can then help to ensure that patient really does understand what needs to be done. And that reduces readmissions, which of course reduces costs.
Absolutely.
And with all the changes in the healthcare system, these are critical steps to reduce costs and improve reimbursement, improve patient satisfaction.
I completely agree. I think the other thing that we were discussing earlier was around HIPAA and patients that request their medical records, and how some facilities may send their records to an interpreter that may not be HIPAA compliant.
Yes.
And things of that nature. Tell me about your company and your services and how you stay within the HIPAA guidelines, or help hospitals and physicians stay within the HIPAA guidelines.
Yes, we work very hard to do that. With translations, very often hospitals or health plans even will send off a translation, a medical record. Maybe the medical record is written in another language. It might be written in German or French or Khmer. And they get that medical record, they need to process a member claim. They're not sure what it says. They need the help of a translation company to assist with that. If the translation company simply scans a document and emails it to someone, there are a couple of problems. One is that email is not secure. It might be secure from the health plan to the translation company, but from there on, what are their procedures? The Magnus portal is a secure system whereby health plans can interact with us, let us have the medical records. We can then work with the linguists, again, through a secure portal that allows us to encrypt and control that document. Not only do we encrypt it and control it, but we also know who has had access to it. Because under HIPAA, patients have the right to know who has accessed their medical records.
It's very important. And along with going, sticking with the idea of how important this is as it relates to HIPAA, I know that electronic medical records are now becoming the norm for a lot of facilities, and with that increases the need for clear and better communication. Can you talk about your company as relates to that aspect of your services?
Well, EMRs are a way to avoid a lot of the paperwork that's generated. Our role in the process, we still work with information, whether it's electronic or paper. And the EMR it's just another way for us to interact with that patient medical record in a secure way to ensure that the information is conveyed clearly, so that providers know what the patient had done and then can treat them appropriately, and that reimbursement can connect appropriately as well.
Excellent. So, Richard, what are some of the other key programs or services that Magnus offers to the healthcare space?
The basic idea is that Magnus is a healthcare company, and we specialize in languages. So if a healthcare plan wants to, or a hospital wants to better educate clients, better educate patients, better educate members, we can help in that process. So whether it's developing a script for a telenovela as a way of educating members, or whether it's designing a brochure, or it's translating those health head materials. When messages need to be communicated in different languages, whatever way they need to be communicated, that's what we do. Okay.
If there was one message you could convey to a physician that is thinking about your services or the need for these services, what would that be?
The number one thing is to make sure you're working with a qualified provider. Just as we want qualified physicians, we really need qualified linguists as well. There are very, very good linguists out there, and there are some which pretend to be qualified. The best linguists are going to have training, they're going to have a degree in translation or interpreting, they're going to have years of experience, they're going to specialize in a particular area. Just like physicians do, interpreters and linguists are the same way.
Perfect. Richard, your company provides a great service that's much needed in the healthcare space, and I appreciate the time you gave us today, and good luck with your company in the future, and I appreciate your time.
Jamar, thank you very much.
Thank you.
Okay.
All right. And this is Jamar Brown with Successful Physicians Monthly, reporting live at the Innovation Economy Expo.